COVID-19 patients in self-isolation in their homes have asked the government for more support, saying that food rations they're being given of maize flour and beans are not enough. They say they also need a way to buy other things like vegetables.
Gerard Rutaisire and his entire family have been in self-isolation in their home for more than 2 weeks, sick with COVID-19, and some of them are not doing very well. I went to Kachiru Hospital and got tested, and the results came back positive. I was the third and last member of this family to get sick. The family and others like it in self-isolation are grateful for the assistance they are getting from the government and local health workers, but they say their situation is still dire. I am the breadwinner for this family, and now I cannot go out and find a way to make money, and that is a problem. We are trying to save the little we have here at home, but we don't know what we are going to do in the coming days. Poverty is a problem because there is no work, and I am wondering where I will get my rent money or even how I will eat. My neighbors are the ones helping me. When I was very sick, all I could eat was fruits and soup, but that is for people who can afford such things. Some of the other local residents would come and give me what I needed, and I am grateful for what they did. Plus, they kept their distance, afraid of getting sick. They would leave the supplies over there and we would go and get them because no one dared to come here. Local health workers and other residents say they have been doing all they can for the sick. In some cases, you find a person sick and unable to work in the family, yet they have not cooked any meals that day. In such cases, we do advocacy on their behalf with the settlement leader and other local leaders, and they mobilize supplies of things like rice, beans, and even cash so that we can buy vegetables for those that need them the most. We have 8 people here that have COVID, and we check on them regularly and give supplies. But they are not enough, and that is the most pressing problem facing us right now. Officials in the Ministry of Health say that more than 95% of all COVID-19 patients are in self-isolation in their homes and that they are being cared for in collaboration with the Ministry of Local Government. We work with local authorities so that they are monitored and those who need help get it. And this is being done through consolidated efforts with Minalok all the way down to the authorities at the settlement level, so that anyone in need of more than just medical services is cared for as well at the settlement and neighborhood levels. Sufficient instructions have been issued on how they are to be catered for. Even though the patients admit that they are catered for and given supplies of things like maize, flour and beans, they say the government should try to give them more. The Ministry of Health says the self-isolation strategy has been yielding results, and anyone in need of specialized care is transferred to COVID-19 treatment centers and hospitals.